So another question is actually about restrictions in eye movements. So that is absolutely something that can be trained. So sometimes you'll get the report from the ophthalmologist or the eye doctor that the child doesn't have an ability to move and that there's a restriction in gaze. It's really important to do eye stretches. So that's one of the primary things that we do with most of our patients is actually trying to get them to track and look up and down and side to side and then along all of those diagonals. Slow stretches. And again, with a child, you're going to have to engage them in things that they're interested in, whether it's a little toy or a car or even a treat. But I do think it's really important to do the tracking. Now, sometimes it's a little bit more difficult if there's balance or coordination problems. So you might just start with them laying down. So while they're on their back, maybe on the changing table, you can actually have them look and track. Just a mobile above the crib is very useful as well. So I definitely think it's important to get those eye movements going. And then if there's a vision impairment, you might need to use high contrast targets like black and white, or targets that make sound as well to engage and again coordinate that visual, that vestibular system, so it's okay to let them move their head somewhat, and also that sound. Another thing that we'll do too is use prisms. So if I'm actually working with them in vision therapy, I might use prisms that will emphasize different fields of gaze. So sometimes we'll just send home glasses that actually rotate in different directions and then ask the parents to do the tracking or the eye stretches while they've got the prism glasses on. So those are all things that kind of fall under the title of ocular motor dysfunction. And that really just means that there's a fixation or tracking problem. So those are definitely skills you can work on. You can contact me. I have lists of games and activities that you can work on. Most OTs are trained in ocular motor dysfunction and can give you some suggestions as well. Kenneth Lane wrote a book about eye movements, more for occupational therapists, but optometrists use it as well, that has 100 activities to do to work on tracking. But again, it's really just get in there and have them do tracking and stretching the eyes and looking from point to point. So shifting gaze, saccadics is another activity that you can do. I Spy books, word searches, Connect 4 game, Battleship, matching patterns near and far can also work on shifting fixation. So there's a whole host of things that you can do to develop it, and it is definitely trainable and you can work on it.